Are you somebody that suffers with frequent headaches, headaches that are usually one-sided around the eye, into the temple, and around the ear? If that sounds familiar, this video is going to be great for you. Hey, I'm Dr. Putney with Wellington Family Chiropractic, and today I'm talking about headaches, usually one-sided for a lot of folks. They're frequent, but they actually aren't a problem with the head. They're coming from somewhere else. So within the muscles around the shoulders and the neck, we tend to develop what we call trigger points, which is a tight spot in the muscle that becomes unhealthy. It loses blood flow. The nerves get inflamed in that area. And you begin to have pain. And usually that pain is not at the site of the trigger point. It will refer pain into different areas of the head and neck. So specifically for this area right there, there's a nasty trigger point that usually develops in the middle of the upper trap along the front side. And so a lot of times when I have patients tell me they have a headache right through here, I'll go right in there and palpate or feel that area, and you can feel the trigger point. And when you get on it, it's either really sore around that area or it recreates the pain they have. So if you're somebody that has that one-sided headache, what I want you to do is go ahead and palpate your shoulder across the trap and come across into the front side of it and dig right there. I can feel a little one on myself, and this is something that happens to me. So if you have a tender area there, or a tightness in the muscle, or a knot that doesn't feel like the rest of it, that's a trigger point. And if it's active, it will refer up into the head and cause those headaches. So what do you do for it if that's there for you? Well, there's a couple stretches I'm going to show you, and then a way that you can massage yourself. So with that muscle, it is part of the trap. What you want to do to stretch it is to grab the bottom side of your chair to pull that shoulder down. And then what you're going to do is flex your head away, and then bring your opposite arm and pull until you feel your range of motion stops, and stretch for about 10 seconds. Then what you want to do is contract your head up into your hand, not full force, but a little bit of pressure, and then relax, and you'll notice that you can stretch further, and you'll stretch for 7 seconds, contract for a few, relax, and you can go further. And you want to do 3 or 4 rounds of that to where you're stretching for about 45 seconds. So you can do that 2 to 3 sets multiple times a day if you've got that trigger point there. For some people, it's a little bit further back, and they feel a little bit more stretch if their chin's closer to their opposite collarbone as they pull. So you can work that area and do the same contract, relax. You can rotate your chin sometimes, and you'll feel that area get a bigger tug, and the same stretching rules apply. The other thing I show people how to do is just massage that area yourself. So trigger points do well if you can get some blood flow into them, which is the main problem with a trigger point. It's not getting blood flow. So if you can find that trigger point, what I'll have people do, it's tough with a collar, is normally you'd go right underneath the collar of your shirt and start above where the trigger point is. So if it's here, I'm going to start here, flex towards it, flex away, and then with the pad of your fingers, you're going to sweep through all the way to your AC joint right here. So as you flex away, we're tilting down, and that actually recreates that exact same pattern. So that trigger point on me that gives me problems is actually a little flared up today. And you'll feel it as soon as you start to hit it and stretch it. It'll start to create that pain pattern. And so what you want to do is just work up and sweep all the way down with pretty good pressure that you can tolerate. And I'm just tilting my head first, and then rotating my chin and sweeping again from above the trigger point all the way out to that bony part of your shoulder, your AC joint. And what I'll do is I'll work on that if it's acting up on me for about 90 seconds to 2 minutes until I feel that referral pattern start to dissipate. And if you do that while you have a headache, a lot of times afterwards you'll notice the headache is either decreased in intensity or it can be gone completely. So remember, there's 2 stretches you can do. You can self-massage that spot, but if you're having a headache right here, look here first, see if you can work that out to improve your headache. I hope this helps you guys out, and I'll talk to you soon.